And once again, welcome to my Oet channel. Today, also, we will see another one Oet role play which appeared in the exam of September. So, this is a real exam oriented question, and I will present you the question paper with the relevant underlining so that I hope it will be helpful for you. And today's role play, we are focusing on a scenario on hospital. So they didn't mention that whether it is a hospital ward or it's outpatient clinic or nothing. Nothing but this patient is 45 years old patient who is scheduled for a hernia repair in 2 months. So he or she has been advised to quit smoking at least 2 weeks before the operation and has come to see you for more information about smoking cessation. So here this one actually the patient is scheduled for the surgery after 2 months, but before 2 weeks itself, the patient have to achieve quit smoking. The patient tried many times by himself and he could not achieve the quit smoking. That's why he came to you to ask some information regarding smoking cessation. So this is an unknown scenario, and the first question is confirm. Same like as I informed you earlier role play. Confirm means you have his note with you, maybe in the system or like in paper way. So you have to get the confirmation, but you can ask the patient's name. So we will start. So just be in reality that you are in the hospital ward and you are giving advice to the patient. So the first question will be like this. So first we can introduce ourselves. Good morning, my name is Rashmi Raj, one of the registered nurses working in this hospital. How may I address you? Then the patient will tell names. So example, maybe the patient's name is George. So we can tell like this. Well, Mr. George, if I am not wrong from my system, I can see that you are scheduled for hernia repair after 2 months, and now you have some concern regarding the smoking cessation. That's why you are here. Is it correct? And like that, we can ask. Or else, in a simple manner, you can ask how may I help you. In that way, also we can ask. But if the first task it's given like confirm means this is the right way. Then find out the details about patient smoking habit. So we are just moving to the next question. Before proceeding further, then the patient is telling that, yes, sister, I came here for getting some information regarding the smoking cessation. You can tell that, okay, George, no need to worry, I'm here to help you. Before proceeding further, may I ask you some questions about your smoking habit? Then patient is telling, okay, sister, you can ask. Then we can ask about the onset, amount, attempts to quit. So how we can ask, Mr. George, could you please tell me regarding the onset of your smoking, from when you have started, how long you are smoking, and how many cigarettes you are smoking, and what type of cigarettes, and have you tried to quit smoking before any time? Like that, we can ask the question. And then the patient is telling that maybe I have been smoking for the past 30 years and now I smoke about 15 cigarettes per day. And I have tried to quit many times in the past but have not been successful. So we got the idea that patient already tried to quit smoking but it is unsuccessful. Then our next question is explore how patient previously tried to quit. It's like on his or her own or smoking cessation program or hypnosis like that. So we can ask, thank you for your information, Mr. George. But I want to ask you another one more question. As you told that you have tried to quit smoking, but may I know how you tried by yourself or by any smoking cessation programs or by any hypnotic techniques? Then patients telling that actually I have tried to quit my own and I have never tried anything else. And the patient, along with that, patient is asking another one more question. Just I want to ask you that why I need to quit smoking before my surgery. So what is specification of this smoking and surgery? Then we can tell that of course, Mr. George, I am appreciating your concern and I am here to explain you regarding the need of quit smoking before the surgery. Then we are going to explain the surgery risk associated with smoking. This has given like post-operative, there is a complication, there will be the complications, there may be the complications like lung and heart complication, anesthesia difficulties because the lungs will aggravated by tobacco like that. So we can tell that I'm extremely sorry to tell you, Mr. George, because you are a heavy smoker, and there are some complications associated with this surgery if you are a heavy smoker, because post-operatively there may be the chance to get lung and heart complications, and sometimes there may be the chance for anesthesia difficulties also, because your lungs is aggravated already by tobacco. But no need to worry. If you quit smoking at least 2 weeks before the surgery, we can reduce the risk as much as possible. So if you are telling, if I'm sorry to tell you like that, you are going to tell any negative things, because it's a complication, and this is like chronic complications. So there you have to give the reassurance also, like no need to worry, we can do something like that. Then the next question is, give advice on smoking cessation. Then so the patient is telling that, okay, I can understand that it is important, but I can tell you that it is not easy for me, because I am a very strong chain smoker, and I have tried already many times in the past, but I don't know within these many months I can do that, like that patient is telling. Then now we can tell, no need to worry, Mr. George. If you are willing and if you follow all our advices, I am reassuring you that you can do that, because we have many patients as you with the same conditions, and they have tried our advices and the program. They have undergone many programs and successfully they quit smoking within time period. So I can reassure you that you can also do that. Like that, we have to give the reassurance, because from patient's mind, he is telling that it will not be a successful, so it cannot happen. So we have to give additional reassurance, and we can give the explanations. And for that, I would like to give you some suggestions for smoking cessation. Like you can replace the smoking routine. Whenever you want to smoke, you can divert your mind with any other activities like exercises or movies, going outside, having fun with the family, something like that. And you can it is important for you to increase the exercises also, and please try to get some alternative methods of relaxation like yoga and meditation. And another important thing is, please avoid triggering, because maybe sometime maybe you will smoke because of some tensions or any triggering factor. So please find out what is the causative factor which will stimulate you to smoke, and please try to avoid those triggers. And I would like to tell you that if you quit smoking, there are many benefits in your life. You can you can avoid many complications like related to lungs, and your life will be quality, and the quality of life can be ensured. So like that, we can give them suggestions, and you can tell that. And so George, if you don't know regarding yoga and meditation, of course I can give you the pamphlets or leaflets. In that, some yoga techniques are meditation techniques are explained, and with your convenience you can select those practices. How does that sound? Like that, we can ask, because we are giving more suggestions. Then we can ask, how does that sound? These sentences, actually I told you like in a continuous manner, but no need to tell in one sentence. You can split it into 2 or 3 sentences. In between you can ask, are you following me? Are you getting my point? How does that sound? Like that, you can ask. Then the last sentence is warn against routine patches. That means patient is telling that, we are asking how does that sound. The patient may tell, maybe I can go for your advices, but I'm feeling that it is better to go for nicotine patches. Then we can warn against the nicotine patches. We can tell that, I can truly understand your concern, Mr. George. It is easy way for the quit smoking, but I would like to tell you that, or I am sorry to tell you that, nicotine replacement therapies have some complications, because this practice involves still the nicotine presence in the blood, which will leave nicotine presence in the blood. So I can tell you that other than these nicotine patches, you can select any of my advices or any of my programs, so that it will be beneficial for you. Are you okay with that? Like that we can ask. Offer to provide information on further support available. And we can tell that moreover in our hospital there are some supporting groups are available, like a counseling sections and some other quit smoking support groups, so in which you can get additional helps, and someone will guide you for each and every day, for each and every steps of this quit smoking programs. So if you are interested, I can make an appointment with these counseling sections. Are you okay with that? Like that we can ask, and the patient is telling that, okay sister, I can feel that the suggestions are good and you can make an appointment for me with these groups. I hope I will get some reassurance and suggestions from these groups. Then we can conclude that I am appreciating your willingness to get an appointment, Mr. George. Once again, I am reassuring you that if you follow all our advices in this counseling sections and the support groups, of course, within time period, you can quit smoking and you can have a low risk surgery. And I hope there will not be any complications after the surgery also. Then we can conclude. If you do you have any other concern, we can ask. And if you don't have any other concern, may I proceed with the appointment? Then patient says, yes, so you can. Then we can conclude. Thank you. So that is only the scenario here. Actually, this is a small role play, and it can be a first role play card, because as you know that there are two role plays, and the first one will be the smaller one and you will get enough time to finish within 5 minutes, but the second one will be large enough and you will not get enough time, so that you have to be somewhat fast enough. And actually in OET you can get in first role play maybe home visit, or same like the scenario like clinic, like PD, hospital clinic, community health centers, and in emergency department, but a short review or something like that. And even in the hospital ward also, but it will not involve more tasks and subtasks. But in the second role play you can get something related to surgery, pre-operative preparation or pre-procedure explanations, and when you're getting discharged, the discharge process, and emergency department scenario, hospital ward scenario. So like that, the second scenario will be somewhat large. So train your mind to handle both role plays, and please learn how to conclude within time, how to make the scenario within 5 minutes. So you can set a time and you can practice. And if you want to get the recent OET role play questions, you can join with my Telegram group, and the link is given in the description. You can go to the file section and you can see the PDF, and there I have posted 2022 recent OET role plays, so speaking role plays. In that you can see even the date of exam. So all those questions are already asked in OET, so you can practice yourself with your friends or with anyone. So it will be beneficial for you. So I hope this role play is clear for you. Thank you for listening, and we will meet with another one informative video. Until then, bye. Take care.